The three most common cheerleading injuries are concussion, sprains, and muscle strains. So concussion, surprisingly, cheerleading is, that's one of the sports that has the highest concussion rate, surprisingly. Or maybe not surprisingly, when you see how cheerleaders do a lot of flips in the air, and then they might land a certain way in practice and bonk heads with another person or on the floor. Campbell Clinic has concussion specialists, so if a concussion is suspected, try to make an appointment right away because it's important to catch and diagnose that concussion so that way they can get better quicker. The other common injury are, as I mentioned, was sprains. So it could be wrist sprains from doing tumbling or lifting. It could be ankle sprains, again, from the tumbling. And then the last one is muscle strains. So it could be any of the muscles, really. It could even be the back, especially those who are doing the lifting of the other cheerleaders. In terms of injury prevention for these types of injuries, best thing to do would be to utilize proper technique. In practice, I'm sure everybody has the practice mat, so in case you fall, you have something softer to land on. If you're already starting to feel some pain in the wrist or the ankle, preemptively using like taping it so that way you don't bend your wrist back all the way, or using a brace temporarily to help keep things stable. But really the most important thing is strengthening. So making sure that you do some strengthening of those muscles and getting adequate energy in to match the energy out, so that way you don't feel so tired and then the muscles give out on you. Overuse injuries are definitely a problem, and it's hard in this day and age because now we're doing even more. If you compare the kind of performances and routines that we're doing now compared to like 20 years ago, they're a lot more elaborate. They demand a lot more from the body. And so if you're doing this more challenging routines and movements, but still having the same type of hours that you're doing it, you're gonna break down. And so it's super important to have relative rest. And that could be, it doesn't necessarily have to be resting completely from all activity. It could be changing the activity that you're doing so you're using other muscles. And so that's going back to doing another sport, doing another aerobic activity. So that way you're still training your cardiovascular endurance, but you're allowing the muscles that you use over and over and over again to rest while you use other muscles to get them equally strong. Stretching is super important after strenuous activity because then as the muscles cool down, you don't want them to get too tight. And then in terms of stretching, I always tell my patients that when you stretch a muscle, you want to hold it for at least 30 seconds. In the literature, they found that that's the minimum amount of time to get a nice lasting stretch in the muscle. Anything less than that, it's almost as though you didn't do a stretch at all, so it's kind of useless. So it has to be a slow count of 30, like 1 Mississippi, 2 Mississippi, that sort of thing. Whether to use ice or heat is always debatable, but it really depends on the type of problem. So if you feel like you strained a muscle or the muscle feels like it's spasming, like it's tight, heat is actually better for that. If you just sprained your ankle and it's swollen and it's hot, then you actually want to put ice on it. You want to bring down that inflammation. For most of the acute injuries, ice would probably be the better go-to on the safer side. Yeah, warm up and cool down are super important for injury prevention. Warm up your muscles starting off cold. You want to warm it up before you start really doing heavy activity. Otherwise, you might pull a muscle, right? And then cooling down is also super important because then you don't want the muscle to become tight and potentially tear when you try to do something again. Yeah, for that reason, stretching is also very important, both before and after your activity. So after you warm up, it's important to stretch the muscle so that way it becomes more pliable, more ready to go. Again, to prevent like a sudden strain, a sudden tear in the muscle. And then same thing with cooling down. The nice thing about Campbell Clinic is that it's multi-disciplinary, and since everything is kind of housed within this, we're able to offer a team-based approach to care. And so I myself, when I take care of dancers, for example, I collaborate closely with the physical therapist, and there's open communication between us. So if they're saying, hey, I think I see this in one of the dancers, can you check? And after I see them, they, oh yeah, this is what's going on. Make sure that you focus on this muscle group to try and get to like this type of functional movement so they can perform better, as an example. That happens very seamlessly and easily, and I think ultimately the patients get the most benefit from that.